Emily is a licensed marriage and family therapist and is certified in perinatal. Did I pronounce that right?
Yes.
Good. Mental health. And she spent her career developing an expertise in working with couples and individuals struggling with infertility, pregnancy loss, birth trauma, and motherhood transition. Emily has received postgraduate training in infertility counseling, perinatal mood and anxiety disorders, pregnancy, grief, and loss, EMDR, emotion-focused therapy, Gottman level 1 and 2, infidelity, and betrayal trauma. Emily is the founder and co-owner of New Beginnings Counseling Group in Utah County and the president and founder of the Utah Reproductive Mental Health Network. She's a clinical fellow of the LMFT, a mental health group member of the American Society of Reproductive Medicine, a professional member of PSI Utah, and an approved supervisor for UAMFT. Super accomplished. Look at that list. It's amazing. Emily's presentation today is titled Sex, Intimacy, and Infertility. You can be prepared today to learn what infertility is and the causes of infertility, know how men and women experience infertility differently and the challenges these differences have on relationships, understand the psychological and social impact of the infertility, and learn about the impact of infertility on sexual intimacy, practices, and functioning. Emily will hold an anonymous Q&A session for the final 15 minutes of this 1-hour webinar. And we've changed our system just a little bit. So this webinar is approved for 1 CEU. And instead of emailing me, you can fill out the survey that pops up at the end of this webinar. And on the last question, there's an option to select that you're requesting a CEU. So yeah, okay, I want to give you as much time as possible. I'm so excited to have you. We have a really great audience today. Let's get started. Thank you so much for being here, Emily.
Wonderful. Thank you so much. I'm really excited to be here and to talk about infertility and help everyone who is attending to better understand more about this really common problem. And on this introduction of this topic, I really wanted to kind of give you a taste of what the infertility experience is like. And these little pictures on this slide kind of encapsulate what it feels like to go through infertility. And it's a really difficult thing to really talk about because a lot of people feel shame and don't feel that there's a lot of support out there. And so I'm hoping that with this presentation, I'll be able to increase awareness and also increase conversations that hopefully will generate some better understanding and sensitivity to this really difficult thing of infertility. I wanted to first share my own story and let you know that I'm an infertility survivor. I will show you a quick picture of my cute little family. So I'll give you a quick synopsis of my experience. Shortly after I graduated from college, my husband and I made the decision that we wanted to start a family. And we're really excited about that opportunity. And we started, like everyone else, with great hope and anticipation for that wonderful opportunity to become parents. And little ways in, we realized that we were going to have some problems due to some health issues that I had. And we soon discovered that it was not just going to be a short stint of infertility, but it ended up being nearly 7 years of infertility for us. And as you can see, my story ended up in a really happy place. I ended up having 2 sets of twins because I went through in vitro fertilization. And as much as that is an incredible blessing, my experience with infertility literally changed my life and is really a big reason why I have chosen to specialize in this area as a mental health professional, because of the challenges that it was for me. And so I'm really excited to be able to not only share my expertise, but to also let you know that this is something that is really close to my heart. So the first thing I want to do is talk about what infertility is. Infertility is not an inconvenience. It is a disease of the reproductive system that impairs the body's ability to perform the basic human function of reproduction. And I think sometimes this concept of infertility gets misunderstood because we don't necessarily know, what the story is behind people not being able to have children. It's kind of a taboo topic to bring up for a lot of people because we don't know if people are choosing not to have children or if they are having problems to have children. And it's not necessarily a topic that we feel comfortable bringing up. So I want to just really emphasize the fact that infertility is a disease. It's not something that people necessarily choose to do. It's a very painful process for many, many couples. So I want to share a short little video about infertility. What is infertility? And some of the various things that happen to increase the risk for infertility. So I'm going to ask you just to be a little patient for this short little video and go ahead and learn a little bit more about what infertility is and some of the things that occur when going through infertility.
Carry a pregnancy to full time. This means a woman gets pregnant but keeps having miscarriages or stillbirths. About 20 to 35% of infertility cases stems from the woman. 20 to 30% is traced to the man, and the rest of the time it is caused by combined problems in both partners or due to unknown causes. 8 to 12% of couples worldwide experience infertility problems. Oftentimes, the factors that cause infertility in couples are present at birth, and at times they develop later in life. Causes. In men, the milky juice that a man releases during ejaculation is called semen. This semen is made up of sperm and fluid. The sperm is produced in the testicle, and the fluid comes from the prostate gland, the seminal vesicle, and some other sex glands. Infertility in men arises when there is low sperm count. In other words, a low amount of sperm is ejaculated. A sperm count that is below 15 million is considered small. Abnormal sperm, for example, the shape of the sperm is unusual, making it difficult to move and fertilize an egg. Low sperm motility. For example, the sperm cannot swim well and therefore cannot reach the egg. The above problems can result from medical conditions such as diabetes, cystic fibrosis, mumps, hypospadias. Sexually transmitted diseases such as gonorrhea, HIV, chlamydia. Unhealthy habits such as excess alcohol consumption, illegal drug use, anabolic steroid use, which is popular with athletes and bodybuilders. Smoking and testosterone supplementation can seriously reduce sperm count and motility. Exposure to chemicals such as lead and pesticides. Overheated testicles, which can be caused by a varicocele, a condition in which the veins on a man's testicles are largely making them overheat. Undescended testicles, frequent exposure to heat that may result from wearing tight clothes, working in hot environments, the use of hot tubs or saunas. Age, overweight or obesity. Mental stress, especially if it leads to reduced sexual activity. Cancer treatment, such as chemotherapy and radiation. Structural problems, such as injury to the reproductive organs or blockage in the testicles. In women, to get pregnant, an egg must be released from one of the ovaries. The egg must fertilize. The fertilized egg must go through a fallopian tube towards the womb and attach to the inside of the uterus. Infertility in women arises when there is ovulation disorder, which affects the release of eggs from the ovaries and is the most common cause of infertility in women. An ovulation disorder can result from polycystic ovary syndrome, or PCOS, premature ovarian failure, where the ovaries stop functioning or fail before the age of 40, poor egg quality, thyroid problems, hyperprolactinemia, chronic conditions such as AIDS or cancer, uterus or fallopian tube abnormalities. This can prevent the egg from moving from the ovary down to the womb. This abnormality may be due to surgery, which includes pelvic or cervical surgery, endometriosis, a condition where endometrial tissue lining the uterus grows outside of the uterus. Submucosal fibroids, where benign tumors occur in the uterine wall. Sexually transmitted infections, such as chlamydia, can damage the fallopian tube. Medical conditions such as lupus, poorly controlled diabetes, amenorrhea, or the absence of menstruation, and genetic abnormalities. Age, alcohol use, being overweight or underweight, smoking, exposure to certain chemicals such as lead and pesticides. Symptoms. The major symptom of infertility is the inability to conceive. At times, an infertile woman may have irregular or absent menstrual periods. Diagnosis and treatment. Diagnosis in men may include semen analysis, where your semen is collected for analysis in the lab. Blood test to determine the level of testosterone or any other male hormones. Genetic testing to check for any genetic defect that may be causing infertility. Diagnosis in women may include blood test to measure hormone levels to determine ovulation, an imaging test to look for uterine or fallopian tube diseases, ovarian reserve testing to determine the quality and quantity of eggs available for ovulation, hysterosalpingography to check the condition of the uterus and fallopian tubes and look for blockages and other problems. Treatment. Treatment in men. Improving lifestyle and behaviors. Medication. Surgery. Sperm retrieval. Treatment in women. Fertility drugs may be used to regulate or induce ovulation. The blocked fallopian tube may be repaired by surgery, making it easier for eggs to pass through. Intrauterine insemination. At the time of ovulation, healthy sperm are placed directly in the uterus. This procedure is done when a man has a low sperm count, low sperm motility, or when the cause of infertility is unknown. Assisted reproductive technology. A procedure where eggs are surgically removed from a woman's ovaries, are combined with sperm in the laboratory, and are returned to the woman's body or donated to another woman. The most common type is the in vitro fertilization, or IVF. Other types include assisted hatching, gestational carrier, intracystoplasmic sperm injection, or ICSI, donor eggs or sperm.
Okay, so I hope that that summary video was helpful for you to understand a lot more about what infertility is and some of the causes of it and how to do treatment for infertility. I wanted to ask if you understand what types of infertility are present. A lot of times people assume that infertility is simply just not being able to get pregnant. But there are actually two types of infertility. The first type, as you can see here, is primary infertility. And that's what most people think of because it refers to a couple who are not able to become pregnant after at least 1 year of having sex without any kind of birth control methods. I had indicated in my intro video that the CDC talks about how 1 in 5 couples experience this kind of infertility. And that is such a high number. And it's really remarkable because it makes us stop and think just how significant this problem is. The second type is secondary infertility. And this is one that many people may not even assume as being infertility because it refers to a person who may be able to get pregnant and have at least 1 or 2 children, but then they have problems getting pregnant for additional children. So this is something that we need to know and understand, that there are these individuals who may struggle with infertility after they've actually had children, and it's still as painful as primary infertility. And a lot of times people will make insensitive comments that really can be hurtful. Well, at least you have a baby, or at least you can get pregnant. And these are really, really painful things for people to hear when they are struggling with infertility. Okay, let's see. So I'm not going to be spending a ton of time. The video spent a little time on this already about what some of the treatment options are for couples who are struggling with infertility. But I did want to just take a moment to mention a few more that were not mentioned in the video. Couples who go through infertility do have options, and that's, you know, the blessing of medical technology and the things that they've been able to learn over the years. But there are certain things that may come to a point where a couple may not be able to do any more than what they've been able to do. And so there are limitations that lead them to making other decisions, like should we hire a surrogate to carry a baby if the mother is unable to sustain a pregnancy? When do couples get to the point where they've done everything they can medically and make a decision to adopt? And then finally, there are couples that actually choose to be child-free. And I want to emphasize that none of these options are easy for couples to get to. There's a lot of pain and suffering that comes from these experiences to have to make really, really hard decisions. And in many ways, a lot of these decisions are based on their financial abilities to be able to pay for these things. So it's something just to kind of keep in mind. So the next thing I want to really emphasize and talk about is how men and women experience infertility differently. And you can imagine that there are going to be some significant gender differences between men and women because of their reproductive roles in creating families. And I think it's important to understand that there are these differences, that men and women do experience a lot of pain and suffering, and yet it's a very different experience for each of them. So let's just focus a little bit on what it's like to be a woman and experiencing infertility. I'm just going to highlight a few of these things. The first one is that infertility is often viewed as a female problem. And that seems pretty logical, right? Like we all have, an understanding that the woman is the one who's going to carry the child. So we often would think that it would be related to the female. However, we know, based on the information from the video and just from research, that it really is a 50-50 problem. Some of it is, female-related issues, some of it are male-related issues, and then some, it could literally be both, or it's simply just unexplained. So we have to take into consideration that it's not just a female problem. It's really difficult because a lot of these treatments for infertility require the woman to be the one to undergo these treatments. And so it can be very invasive and stressful for women who have to endure these kinds of medical procedures. Women often take on blame and blame themselves regardless of the cause of infertility, and will often think of themselves as broken or that something's wrong with them because they're not able to do what a normal, healthy woman is able to do. This can often lead to an identity crisis for women, because if they've had a vision of who they've wanted to be, if they wanted to become a mother, and all of a sudden they're faced with the reality that that may not be the case, they have to do a lot of soul searching and going into digging deep on who they are if they aren't able to become a mother. And then finally, we're going to be talking about this a little bit later on, but one of the most common outcomes of infertility for individuals and couples is the increased risk factor of anxiety and depression as one of the most commonly diagnosed problems that women experience. So let's talk a little bit about men. The impact of infertility on men is much less talked about. It's not something that is really shared between men because they aren't like women who like to talk, and there may be a lot of misunderstanding and self-blame. And so they may hold back on opening up and really trying to better understand what's going on for them due to this society and other expectations of who men are supposed to be. They're supposed to be the ones that help a female be able to have and conceive a baby. And so men are more likely to compartmentalize how they feel and do so to really protect their partner. They don't want to make it more difficult for their partner to share what they might be going through that journey of infertility. And so a lot of times they may experience internal feelings of humiliation or low self-esteem, or feeling like they're a failure. And a lot of men will express feelings of helplessness. Men like to fix problems, and this isn't something that they can fix. And so this can often lead to a lot of internal stress and frustration, not being able to do anything about what's happening to their wife and them as a couple. And then finally, one thing that I found really interesting is that men and women actually do have very similar feelings of worry and tension, irritation, as well as sadness, grief, and frustration. So that is something that they do have in common, and is something that I think we can help couples better understand. I do want to take a moment and talk a little bit about a new concept that is becoming more and more prominent in the infertility world, and that is an infertility term called social infertility. And this is something that relates specifically to individuals who are single and not married and not able to conceive, as well as individuals in the LGBTQ population. It is specifically shaped by a person's relationship and circumstances rather than a physiological condition. And it is possible to be aware that there can be both social infertility and physiological infertility, where in both instances, the biological ability to build a family will require assistance from an egg or a sperm donor, and for gay couples in particular, having a surrogate. So this is just a really important area that is not well researched, but is definitely something, when working with infertility, that we need to be more aware of, that this is a problem, and many of the same emotional reactivity and issues are things that this special population of single parents, as well as the LGBTQ community, are experiencing as well. So we want to raise our sensitivity to that. So now I'm going to get into the heart of what I'm going to be talking about today, and that is the impact that infertility has on individuals and couples. And so let's go ahead and get started by talking about the psychological impact of infertility. For most couples, infertility is a life crisis. It's not something that they are physically, mentally, or emotionally prepared to handle. Most couples will go into family planning with excitement and anticipation and hope to be able to create a family together. However, that doesn't always happen. And so it can really create a crisis in a relationship because of the challenges that will occur because of this infertility journey that they get thrust into. Research has shown that the stress of finding out that you are going to be experiencing infertility challenges have actually the same levels of anxiety and depression symptoms as do women who experience being told that they have a severe disease like cancer, heart disease, or HIV. And so it's a really, really difficult diagnosis to be given for many individuals, simply because of the issues of lack of preparation, lack of understanding, and a lot of fear and anxiety about what that means and what that future holds for them. Infertility treatment can affect all aspects of a person's life, and we're going to be going deeper into that. But let's talk specifically about the psychological and emotional consequences that occur. So individuals who are experiencing infertility are at much greater risk for emotional turmoil, feelings of insecurity, definitely feelings of isolation and loneliness due to the fact that it may not be something that they feel comfortable talking about. We're going to go a little deeper into that here in a minute. And then feeling significant grief or loss on a routine basis every time they try to get pregnant and the pregnancy doesn't go through, that there's a lot of grieving that goes on. And I'll talk a little more about that here in a minute as well. Certainly depression, anxiety, feelings of loss of control, hopelessness is another really familiar feeling that individuals who have infertility have. Shame and guilt, as we've talked about already, feelings of worthlessness in their life, and we mentioned already an identity crisis. So these are some of the really significant psychological symptoms that can occur when going through infertility. So as we've kind of talked about, there's a huge negative impact on a person's self-esteem. Both men and women will experience difficulty with this. And anyone who, is around someone who's been through this difficult thing will realize that individuals who may have their life planned, those type A personalities where they know what they want, they have a plan for what they're going to do, and this can really, really disrupt their feelings of being in control of their life. They may really feel lost in what to do in these types of situations. And so what ends up happening is that they might become a lot more hypervigilant, focusing on research and data and any information that they can gather, being on platforms that provide them with information, and so that they feel like they have a sense of control. But it ends up resulting in greater amounts of stress because they're so hyper focused. I had mentioned that women in particular will often feel that their bodies are broken, or that they're a literal failure as a woman because they're not able to get pregnant, which they believe should be a natural, normal experience in their life. So with the combination of body systems failing and the responses of what they expect that aren't happening, they can often put their lives on hold and kind of go inward and isolate themselves because it's too difficult for them to live their lives, because they feel like they can't move forward in living because they aren't able to achieve this goal that they have, thus putting them at greater risk for anxiety and depression. So this is where infertility counseling comes in, because, as a counselor who works with this population, what I have found is that individuals who get to a certain point in the infertility journey literally just don't know where else to turn. And to be able to come to therapy and to be able to talk to somebody who understands the complicated issues that surround the infertility journey can really be a great sense of relief. They don't have to explain what it's like to go through this journey. They have someone who's already understood. And so being able to find a counselor who has training, specialty training and experience in working with couples who struggle with infertility can help assist some of these complicating factors that we're talking about today. So if you know of someone, or if you yourself are going through this journey of infertility, I would highly encourage you to take a look at this list and see where some areas might be of concern. Not only we've talked about depression and anxiety, but the preoccupation with infertility, as I was mentioning, marital difficulties with having sex on a scheduled basis, increased use of numbing substances like alcohol or drugs, and even thoughts about suicide or death can be really prominent in this population if they are not resolved. And there is help. That's the good news, is that there is help, and that there is support for these individuals who are going through this, that they don't have to suffer alone. So I want to next go into the social impact of infertility. And I thought that the best way for me to share what this feels like for a woman and a man who goes through infertility is to actually hear from the voices of those who have experienced it. So I have a couple of quotes here that I'm going to read that hopefully will give you a sense for what it's like for an individual to have infertility and how it impacts their social relationships. So this first one says, infertility is the loneliest club I've ever belonged to. Nobody can really empathize with it. Even your mom and lifelong best friend can only say, I'm sorry. And it's not their fault. They don't know what to do. You don't know what to do. Your partner doesn't even know what to do. It's the one thing you both want to give to each other more than anything. You simply can't. The next one is a comment where it says, infertility has infected our lives like a virus. I got to move my little screen here for a second. I think I was fine, make peace with it, just live our lives as happily and fulfilling as I could as a twosome. But it was always waiting for me at every baby shower where the grief would well up and send me to the bathroom sobbing. And this last one, oops, sorry. As the months added up and turned into years of trying, I felt more and more defeated. I grew resentful of those around me who were effortlessly getting pregnant. I questioned everything I'd ever done that might have impacted my fertility or brought bad karma my way. I even developed an overwhelming sense of entitlement. My husband and I were married with college degrees and a mortgage, good people who gave back to our community. Why didn't we deserve a baby when some of our teenage family members were getting one? These are very common thoughts and feelings that people will have, and it can really impact relationships. A lot of friendships and even family relationships can be damaged by individuals that are experiencing infertility. I wanted to share about this social study that was done back in 2002. It was a study conducted where they were observing and asking infertility patients about common social complaints that they experienced by going through infertility. And these are some of the things that they concluded. The first is that individuals going through infertility had increased discomfort around family and friends. They felt a sense that family and friends didn't understand what they were going through. There was an increase of isolation and avoidance of social situations such as holidays, baby showers, family gatherings, etc. There was a decrease in relationship satisfaction and connection with others. There was greater marital tension surrounding infertility and infertility treatments. And there was a negative impact on sexual relationships with their partners. So how do we handle this? I think one of the best ways is to create some boundaries. And so we need to understand the importance of boundaries in the journey of infertility. So what are boundaries? Well, boundaries are physical, emotional, and mental limitations that exist to help protect and keep us safe. Boundaries create a separateness that allows you to have your own feelings and make your own decisions and know how to ask for what you need or want without needing to please others. So I think that's an important thing to understand, is that when you're going through this journey, it's not your job or your responsibility to comfort or help other people understand what your experience is. You're going to be barely able to do it for yourself when you're experiencing this. And so it's really important for you to know that this is going to be a time where you may not be able to provide people with the kind of reassurance they need, that this is a time when you may need that from them. So here's some suggestions. The first thing is knowing that you need to put some boundaries around your privacy. So in other words, it's a time for you to be cautious about what information you are willing to share with others about your infertility journey. One thing that I've noticed is that everyone has a different attitude about this. Some people are very open with others about what they're going through. They may post on social media. They may share their stories on Instagram or a blog. They may be more than willing to answer or ask questions about infertility so that they can feel more connected with other people. But then there are also others who just simply aren't comfortable sharing. It's a very private, very vulnerable place for couples to be, and it's sometimes not appropriate for them to open up and talk about some of the things that they're dealing with. So it's okay to put a boundary around your privacy. The second thing is to think about your social media. This is a really painful thing for a lot of couples and individuals, is they get on their social media accounts and they see all of their friends having babies, going to baby showers, and it just reminds them of what they aren't getting and the things that they're not being able to have. And so it can create a lot of negative feelings and thoughts. Events and holidays. It's okay for you to put some boundaries around and limit attendance at these types of events like baby showers or holiday celebrations, because they can be really triggering. So we can go ahead and think about ways that we can put some social boundaries around that. This is a really important part that I want to emphasize, and that is regarding grief and loss during the journey of infertility. And the first thing is to understand that grief is an inevitable part of going through infertility. Grieving each loss is an integral part of the process, because every loss is an opportunity or a lost opportunity that you have to achieve pregnancy. And so we want to make sure that we understand that grieving is a really difficult process that really doesn't get talked about a lot. We focus a lot on the medical interventions, but we kind of miss the opportunity to actually grieve, because there isn't a specific thing to grieve like a baby. So people experience infertility with high highs and low lows. So it's kind of like going on a roller coaster. You go up with a lot of anticipation and hope and looking forward to the opportunity to be able to get pregnant. And then there's that waiting period where you have to wait until you find out if you're pregnant or not. And it can also be very damaging when you realize, oh, I've got my period, and then you kind of just tank for a little while. So these high highs and these low lows are a pretty common experience going through infertility. And I think it's just really important to have a greater sensitivity that month after month, cycle after cycle, treatment after treatment, it compounds the grief, because you never get a chance to really fully recover from it. I'm going to skip this and go into this part about type of loss called ambiguous loss. And this is a really powerful concept. It's something that I learned when I actually went to graduate school well after my experience after becoming a mother. And it was very validating for me to understand and learn this very concept of ambiguous loss. Ambiguous loss is a sense of loss that is unresolved, uncertain, unclear, something that doesn't necessarily have any conclusion or resolution, and is a loss that is what we call a non-event, something that doesn't happen. So what's interesting about this is it can be really validating for a couple to learn that there's actually words to their experience in going through loss. So let's see here. I'm going to give you a couple of examples. So loss of the experience of being able to be pregnant or to experience birth, the loss of the opportunity to pass on family genes, the loss of the chance to contribute to the next generation, the loss of the chance to parent or to become a grandparent, which is like a secondary loss, low self-worth or self-esteem, loss of family stability, loss of sense of control over destiny or your body in particular, loss of a sense of hope for the future, the loss of a dream, and the loss of your identity. So these are types of ambiguous loss that many women who experience infertility are going to feel. And being able to talk about this and to put a name to it can be very validating for individuals who have experienced this kind of loss. In my practice, one of the things I really love to teach is about the loss cycle. And this is kind of a unique way of presenting it. It's kind of a little teardrop that I use to demonstrate the process of going through the grief and loss cycle. And these aren't in any particular order, but I do want you to just take a minute and look at this process. And to remember what I said a moment ago, that when an individual is going through an infertility experience, the first loss occurs when they realize they are not pregnant. So they get their period and they start on this journey. Maybe they're in shock that, oh, I was so hopeful and I thought that this was going to be the month. You start to bargain, if I just do it one more time, then I'm going to be able to get pregnant. And you kind of get caught up in this cycle of almost an obsession to just continue this bargaining phase. In the middle of all of that, there's a ton of fear and anxiety, a point where you realize, I just can't do this anymore, but you keep doing it anyway. There's definitely feelings of anger at God, at yourself, at other people. But I try to help people understand when I'm talking about this, that it is a secondary emotion. It's not something that's just, the surface. It goes deeper, and what's underneath that anger is sadness. And so we've got to really be able to validate and understand and be able to talk about what's going on underneath that, and how can I move forward and be able to continue on in this journey. There's a lot of feelings of guilt and shame, whether it be how they feel about, are they blaming themselves for the reason why they're not able to have a family? Are they blaming their partner? So there's a lot of those really painful emotions. It is not uncommon, as we've talked about before, for women and men even to end up feeling a tremendous amount of anxiety and depression. And this is where I end up seeing most of my clients in my office, is when they've kind of hit this low of realizing, I can't do this anymore, I need help. And I think it's the best thing that they could ever do for themselves, because they begin to realize that they're not alone, that this is not an unusual experience, that what they're going through is very common. And they begin to realize that this is something that they don't have to go through alone. And it can make a huge difference in a person's life to know that they're not alone when they're experiencing such painful experiences. So this is just something that I kind of walk through, and I'm going to just, you've probably had a minute to look at this. I want to focus at the very end of the loss cycle is a concept called finding meaning. And in the beginning of a person's loss, this is not something that very many people think about, finding meaning in the loss. But this is something that eventually people will get to. And in my own experience, my finding meaning was becoming a therapist, to be able to help other people go through this really painful journey. So please keep that in mind. Okay, so we're going to go into the last section here. And before I start talking about infertility and sexual dysfunction and problems, I want to first talk about sexual health and fertility. So I want to emphasize the difference that the capacity to enjoy and control sexual and reproductive behaviors in accordance with social and personal values is healthy. Having a knowledge of sexual functioning, positive body image, self-awareness about attitudes regarding sex, the appreciation of one's own sexual feelings, emotional connection and comfort, and the stability and desire to have sexual encounters that are free from fear or shame or guilt or even depression and anxiety. All of these things are healthy in terms of sexuality. And the fertility portion of this is being able to have the freedom from any organic disorders or diseases and deficiencies that will interfere with sexual and reproductive functions. So this is an important thing for you to keep in mind as we move forward into this next and last section. So the sexual impact on a couple for infertility is really significant. And I think the main thing that I want to say here is that what starts out as an exciting journey to be able to share and prepare for expanding and building their family is quickly realized that this is not going to be a fun process or an enjoyable process. And it can really, the purpose is to create bonds of strength in the relationship. But unfortunately, what can happen is that pleasure and that experience and excitement of being able to share that planning and engagement in preparing for a family is dramatically altered because of the infertility that they experience. So a lot of us think, this is our idea of what intimacy is supposed to be. But unfortunately, in the infertility journey, this is generally what the experience is. And that is, my computer's being funny. Sorry about that. In infertility, sex requires monitoring. So that includes taking your temperature, peeing on a stick to find out if you're ovulating, keeping track of timetables and taking medication and shots. This can be very difficult because it manipulates hormones and causes a lot more moodiness and irritability that can result in conflict with your relationship, which can often result in a decreasing connection and a lack of desire to be with that person. When ovulation occurs, sex is required, whether the partner is in the mood or not. And so it's performance on demand that makes it really difficult for couples. The act of making a baby, which is normally something that happens in the privacy of your own home and bedroom, now will take place in a hospital room or a doctor's office under fluorescent lights. And so it kind of takes away from this beautiful experience that's supposed to be an intimate memory between you and your partner. There's a tremendous amount of pressure to perform, as we mentioned before. And so sometimes it creates performance anxiety, particularly for men, that results in erectile dysfunction. And that certainly is going to cause more problems in being able to have a baby. And finally, if there's been a previous pregnancy failure, the sexual act may actually be traumatic and become more emotionally complex, that increases anxiety for both partners because of the trauma that they've experienced. In terms of sexual practices and functioning, one of the things that changes when you're going through infertility is the practice of increased frequency. So, for a lot of people, they think, oh, that'd be great. But when you have the pressure of having to perform because you're trying to get pregnant and you can't just have fun and be able to enjoy that connection, that can really take its toll. So there's an increased function mid-cycle and then a decreased frequency during the luteal phase. And you kind of lose creativity in your sexual expression. There's a variety of sexual things that you can do when you're not so worried about getting pregnant or having a baby. And so there's also this change in who initiates sex. Most of the time it's the woman, because she knows what her cycle is and knows what needs to happen. And so she's the one that's more of the initiator, and that can put a lot of pressure. In terms of functioning, the occasional pre-ovulatory impotence or retarded ejaculations can occur. And this one is a really interesting concept called spectatoring. Spectatoring is the art of worrying about sex while you're having it. So it kind of takes away from the intimacy of why you're together and involved in this sexual involvement and intimacy. So that can result then in a lot of sexual dysfunction, both in men and in women. So real quick, sexual dysfunction as a result of some of these issues. A lot of times, as mentioned before, the woman assumes responsibility for all the infertility problems that they're having. And they usually will endure the majority of the medical interventions and treatments in order to become pregnant. A woman who is determined and desires to become a mother is more invested in wanting to get pregnant. They persist and have that determination to continue, even though emotionally and mentally they may be completely drained. They are much more aware of the limitations that of their reproductive health, and most common sexual problems, including arousal phase, orgasm phase disorders, vaginismus, and painful intercourse, can often result for women experiencing infertility. For men, there's a lot of myths about this, that men would often be seen as wanting to be able to engage in sex at any time. But when you're looking at it from an infertility lens, this isn't always true. It feels like unrealistic expectations of men to be able to perform And it's this assumption that is one of the biggest impediments in identifying and treatment of sexual dysfunction in men while going through infertility. It triggers a lot of feelings of failure and inadequacy. And during sexual intercourse for men, it becomes an obligation. It's repetitive, it's routine, it's not fun. And there's a lot of performance anxiety that can result in erectile dysfunction, premature ejaculation. Let's see, sorry about that. And as a couple, your perspective on sex changes. It becomes very methodical, predictable, unexciting, lacking intimacy, and produces a lot of anxiety with the focus on procreation only instead of creating loving bond and connection. I wanted to just mention that there was a study done on 22 infertile couples about sexual satisfaction and infertility. And one of the things that I wanted to really emphasize is a really interesting fact, and that is that despite, and of course this was limited to these 22 people, but despite their unsatisfactory experiences with sex, half of the couples in this study reported that their marriages had become closer than more distant because of the infertility experience. And I want to just echo that that is true. A lot of times something that could really tear a relationship apart is something that actually brings a couple closer together. So I just wanted to give you a little bit of hope that there is some really good outcomes that can come from infertility. Okay, so I think due to time, I'm going to skip the sex tips for couples going through infertility and just conclude by providing you with a couple of the resources that might be helpful. There's a ton of infertility resources, both here in Utah as well as nationally. All of these resources are really helpful to provide information and support to individuals who are struggling with infertility. And then I wanted to just put a plug in. There is an infertility conference that's going to be happening on Saturday, September 17th from 8:30 a.m. to 3:30 p.m. That is sponsored by the Utah Infertility Resource Center. For anyone who has experience or is going through infertility, I would highly recommend that you attend this conference. There's a ton of different classes that are available to anyone who might want to attend, and it can be really, really helpful to know you're not alone. And I think that is it. So I think we're ready for questions. Okay, let's see if I can do this here. Says those feelings of isolation or differentness, alienation, and that no one understands can continue for years, even after adopting. No one else in the family knows what it's like to raise a child who has attachment issues or fetal alcohol syndrome, et cetera, et cetera. That is such a great statement. And I would echo that. You know, as I mentioned before, I went through my own infertility journey, and I'm still traumatized by that all these years later. So I have to really be careful when I'm working with clients to remember that, you know, there was a positive outcome, but it doesn't always happen that way for everybody. And so I think that it's important to know that it's not as easy, even if you are able to achieve adoption or pregnancy, that there are definitely issues that we can't even comprehend that happen even afterwards. So I appreciate that comment. There was another comment about a question about advice for a man to be fertile. That's a really interesting question and a good one. I think honestly, the biggest thing I would recommend is to have a medical evaluation, to be able to really find out what's going on, whether it be motility issues or low sperm count or different problems that they may be experiencing, that there are urologists that can start that process and begin the testing. At some point, they may refer you to an infertility specialist. Usually for women, they usually will refer you out after about a year. But again, it depends on your age as well, because the fact is that a lot of people are choosing to have babies a lot later in life. And so that may move the timeline up a little bit if you are referred out to fertility specialists, where they can do a lot more additional tests. And it's not uncommon for men to actually go on medication to increase their ability to produce more sperm. So there's definitely treatments for men who have, difficulty with producing the amount and quality of sperm that they need to in order to achieve pregnancy. Another comment about adoption, that adoption has its own journey of ups and downs and grief and loss. I totally agree with that. Even though it may achieve the goal of being able to become a parent, there are many, many complicating factors that have occurred for individuals who go through adoption, as was mentioned before, with the issues with some of their mental health issues that may come from a genetic transferring from the birth mom. And so, this is such a drop in the bucket in terms of problems that people will experience going through infertility. And so I really appreciate you bringing that up. And I wish I would have had a lot more time to be able to talk about some of these more specialized circumstances. And that's, again, why I encourage you to go to the infertility conference, because a lot of these issues are presented at this conference. And I would highly recommend that you go there. Okay. Camilla, I don't know if there's any more questions that I can see. Is there anything else?
Yeah, I see one. If you scroll down to the bottom, I see one about, oh, I think you just answered that actually.
I think I've answered the questions. And
I see a question that says, what are some tips to helping an infertile couple get to a place of peace despite what outcomes might occur?
Oh, that's such an excellent question. I think really being able to encourage them to grieve. We talked a lot about grieving and the process of grief and loss. I think the difficulty is coming to terms and accepting what is. And sometimes that's the hardest part, is getting to a place of acceptance. Until you're able to accept where you're at and what the circumstances are going to vary between every couple that comes into this challenging experience. I think the biggest thing is encouraging them to be able to find a place where they can process their grief. And going to counseling is an excellent way to do that, but they also have a lot of support groups out there. They have online support groups, they have Facebook support groups, they have face-to-face support groups. And again, those infertility resources are a place for you to begin, where you can begin having some connection with other people. And that can really make a huge difference, honestly. So hopefully I answered that question. I think we're getting close to being out of time. Let me see if there's any more questions. So it says, do you have any infertility specific trainings you'd recommend for a provider? Yes, I absolutely do. The recommendation that I have is actually a training by the name, a woman by the name of Sharon Covington. She does a 9-month training that you have to sign up for, and it's a really awesome training. Unfortunately, it's not labeled as a certification yet, but I think they're moving towards that. Probably one of the best things I ever did in my practice is to get specialty trained in infertility. There is a resource, an actual infertility counseling book that providers can purchase, and it's written by Sharon Covington. She's the one that actually does that. So hopefully that will answer your question. The question of registering for the conference, what I would recommend that you do is to get on the Utah Infertility Resource Center. So it's UIRC, standing for Utah Infertility Resource Center. And they have an events page that will lead you to a registration area where you can register for the course for that day. Let's see, speak to cannabis use and correlation with low sperm count and quality. Is this accurate? I'll be honest with you, I haven't read a lot of studies about that, but I'm sure that there is a correlation there. But I can't honestly answer that with accuracy. So that's something I think that's a great question, but definitely something that I really don't know the answer to that specifically. Okay, is that everything? that you can see, Camilla?
Yeah, that looks like all the questions. Is there anything you would like me to include? I'm going to send out a recording of this webinar to everyone who registered to review. Is there anything you'd like me to add in that email, like registration info for that conference or anything like that?
Yeah, I can get the link and send that to you. And it's going to be a wonderful conference. Again, it's on Saturday, September 17th. And it is probably one of the greatest resources here in the state of Utah. People from all over the state will come to this, and they have an excellent speaker this year. It's Dr. Julie Hanks, and I think a lot of people actually know who she is. Let me see if I can go. So this is the information right there for you. It's called Stronger
Awesome.
Together, Utah Infertility Resource Center. So yeah, that's the basic information there, and I'm sure you can find it online, and hopefully you could come. Invite everybody to know.
Awesome. And I just want to read this comment I saw in the chat really quick, just because I think it's so wonderful. It says, I went through infertility from 1998 to 2006. It's so amazing to hear and see my feelings and reactions to this experience in your presentation and in the research. I definitely feel very validated.
Thank you.
I just really liked that comment, and I wanted to share that before we close. I think a lot of people feel very validated today, and really appreciate the depth you went into talking about the experiences and feelings of people who've experienced infertility.
My honor and pleasure. I'm so glad to be able to speak to it, because it really is a common issue. And I hope that those of you who watched felt that it was really informative and helpful.